What is open gallbladder removal? Open gallbladder removal. Open gallbladder removal is a surgery to remove the gallbladder via a single, large open incision in the abdomen. It's also called open cholecystectomy. Doctors perform the procedure to provide permanent relief to a person with gallstones and other problems associated with the gallbladder. The gallbladder is a small organ located on the underside of the liver. Its primary purpose is bile storage. The liver makes bile, a substance that helps the body break down and absorb fats. The gallbladder then stores the extra bile the liver makes. It releases bile when you eat a meal with fats that need to be digested. Normal digestion is possible without a gallbladder. Bile will continue to reach your small intestine, but it just won't be stored along the way in the gallbladder. According to the Mayo Clinic, laparoscopic cholecystectomy is the most common type of gallbladder removal surgery performed. It's a minimally invasive surgery. However, open gallbladder surgeries are still used for a variety of people, especially those who have scar tissue or other anatomical complications from prior abdominal surgeries. Why open gallbladder removal is done? Unfortunately, the gallbladder isn't always the most efficient organ. Bile can be thick and create blockages along the pathway where it typically empties. The gallbladder is also prone to develop gallstones in certain people. Gallstones are hard deposits of substances in the bile that can get stuck inside the gallbladder and biliary ducts. They can be as small as a grain of sand or as large as a golf ball. Gallstones can also lead to acute or chronic gallbladder inflammation, sometimes with an associated infection, which can cause bloating, nausea, vomiting, further pain. A surgeon will remove your gallbladder if gallstones cause significant pain and other complications. Other conditions that could make you a candidate for gallbladder removal include biliary dyskinesia. This occurs when the gallbladder doesn't empty bile correctly due to a defect in its motion. Cholecystectomy. This happens when gallstones have moved to the common bile duct where they may be stuck, causing a blockage that doesn't allow the gallbladder or rest of the biliary tree to drain. Cholecystitis. This is inflammation of the gallbladder. Pancreatitis. This is inflammation of the pancreas. A doctor will recommend gallbladder removal if your gallbladder is causing a severe, acute problem or has become a chronic concern. Some symptoms that may indicate the need for gallbladder removal include sharp pain in the right upper portion of your abdomen that can radiate to the middle of your abdomen, right shoulder, or back, fever, nausea, bloating, jaundice, or yellowing of your skin, which typically indicates a bile duct blockage when due to biliary disease. Sometimes a doctor will recommend watchful waiting to see if gallbladder-related symptoms lessen. If symptoms persist, a doctor may recommend surgery. The risks of open gallbladder removal. Open gallbladder removal is considered a safe operation. Complications are rare. However, every surgical procedure carries some risks. Before the procedure, your doctor will perform a complete physical examination and medical history to minimize these risks. Risks of open gallbladder removal include allergic reaction to anesthesia or other drugs, excessive bleeding, blood clots, damage to blood vessels, heart problems, such as rapid heart rate, heart attack, or heart failure, infection, injury to the bile ducts or small intestine, pancreatitis. Your surgeon will explain these risks to you and give you the chance to ask questions prior to the procedure.